Hello, everybody. So hello again, and thank you for joining us today. My name is Shlomit Kenigsberg, and I serve as the Scientific Affairs Officer at the ERA4Health. It's my pleasure to welcome you to the 5th webinar of the NET. The ERA4Health is a European partnership dedicated to strengthening health research across borders, fostering collaboration, and promoting innovative approaches that support prevention, care, and precision medicine. Before we begin, a few housekeeping notes. The webinar is being recorded, and the recording, along with the presentation slide and useful links and further information from the speaker, will be uploaded to the ERA4Health website, and all registered participants will also receive an email with the link afterwards. The topic of today is a consensual evaluation framework for non-pharmacological intervention from research to practice. And I'm very pleased to have with us two distinguished speakers, Professor Gregory Ninot and Dr. Iveta Nagiova. Gregory Ninot is a professor at the University of Montpellier and an expert in evaluation on non-pharmacological intervention in the health field. Since 2021, he has served as Associate Director of the Institution of Epidemiology and Public Health at the University, as well as research manager at the Montpellier Cancer Institute. In 2021, he founded and now he chairs the International for Non-Pharmacological Intervention Society dedicated to the NPIs. He's also co-founded in 2016 the International Behavior Trial Network, which focuses on clinical trials aimed at improving health behaviors. Professor Ninot is the author of 13 books and more than 166 scientific publications, most of which focus on evaluation of the NPIs. Together with Professor Ninot, we have Dr. Iveta Nagiova. She is the head of Department of Social and Behavioral Medicine and senior research leader at the Pavel Joseph Safarik University in Slovakia. Dr. Nagiova is also an immediate past president of the European Public Health Association and a member of the Technical Advisory Group for the Building an Innovation Ecosystem for Public Health at the WHO Regional Office for Europe. After the webinar, the Q&A session will take place, and you can have your question sent by then. Thank you again for being here, and now I hand over to the speaker.
Thank you very much. Hello, everyone. It's a real pleasure to present this work. I will share the document here. Could you see the slides?
Yeah, they're fine. Yes.
Perfect. So I will be in more details about the research, but maybe Iveta, do you want to mention some information more before beginning?
No, thank you very much, Greg. No, I think we should just start with your presentation, and then we can pick up some questions at the end. I think that would be the best order.
Okay, so it's a collaborative work. You know that you can have all the details, the slides, files, but also the document. And Shlomit will send you a link to download all the document, the presentation, but also several guides. So,
Gregory, just a second. It's not in presentation mode.
Again.
Okay.
Yeah. Perfect.
That's okay with you? It's not in presentation mode. It's
if you can, yes, please send directly in the chat. It could be shared in the chat if it's possible, or by email, or.
Oh, that's for sure. We will send all the links, but your presentation right now on our screen is not in presentation mode. So we see all the slides on the side. So you just need to activate the presentation mode.
Is it okay for you now? No?
No. Maybe you have to share your screen and start the presentation, maybe because maybe you are sharing something else and therefore we can't see that.
It's curious. I'm going to try once again.
Yesterday when we tested that was okay. Is
Yeah.
it? Yeah,
Now
that's
it's okay.
Thank you.
Yes, is it okay for everyone? Okay,
Yes.
perfect. So let's talk about non-pharmacological research. And thank you once again to participate to this seminar. And of course, thank you for ERA4Health to have the opportunity to present research more than 15 years. Let's talk about, first of all, drug. When you check in PubMed drug, you have more than 7 million results. When you search surgery, you are more than 6 million results. When you mention this word medical device, you have about 2 million, and only for non-pharmacological intervention, the specific term is only 13,200 results. As you can see, the beginning of this word used by a researcher was in 1975. And so it's just the beginning of the story, because the word was not very known and maybe a lot of confusion was mentioned. So it's just the 50 years of research in this topic. And the first moment that the term non-pharmacological intervention was mentioned is with this document, is dedicated to improve the quality of the use of drugs, specific disease management program to improve adherence, compliance for drugs. But as you can see, the NICE in Great Britain, and after the French National Authority mentioned this term, especially for Alzheimer's disease. But as you can see, in Ireland, in Canada, in the US, especially NIH, in Japan, in China, in Italy, in India, Spain, and now after or in the beginning of the COVID episode, you can see that the European Center for Disease Prevention and Control mentioned explicitly this term. Also Belgium, also the European Commission, and Australia, OECD, and Swiss mention this term. But when you try to read the documents, and especially in internet, you have so many designation, and maybe it's not really clear. We can talk, or the person can talk about alternative medicine, ergonomic intervention, health organization, health promotion campaign, holistic approach, integrative medicine, multi-component, multimodal, procedural interventions, salutogenic intervention, social activity, specific intervention, spiritual healing intervention, supportive care, theory-based intervention, traditional medicine, unconventional care and practice, etc., etc. So it's not really clear. And we can add also another, maybe because it's quite confusing, medical devices, radiation therapy, especially in cancer disease, and surgery. When we focus on some documents, it could be a contradiction, especially World Health Organization. A lot of documents mention non-pharmacological intervention are dedicated to mass media health promotion campaign, only public health measure, but in another part of this very important organization and institution. Here, for Alzheimer's disease or for dementia, they mention some non-pharmacological intervention in the website. So you can have a kind of contradiction between the global health measure dedicated to the population and targeted specific intervention for maybe prevention or care or treatment of some disease. You have also here another paper very recently, this year. They talk about a specific definition dedicated to elderly people. But why only for elderly people? It's for everybody, and not only that. You here can see another document from OECD, and they talk that, they mentioned that NPI are school closures, stay-at-home measure, so very global public health. And last but not least, but the medical editor or the BMG published a paper to say, it's time to move away from talking about non-pharmaceutical or non-pharmacological intervention, and we should mention the term public health and social measures. But we publish with an answer to this paper, but you forget all the specific manualized intervention, physiotherapist, social nurse, dietitian, psychotherapist, etc. And no, please, we have to use the right term. And you can see here, for example, a paper last year published on pain treatments. As you can see, pain is a particular specific goal for non-pharmacological intervention to reduce the symptom, the intensity, the frequency, or maybe to treat some pain situations. Another paper published more than 10 years ago with the team of Paul Glazou and here Mrs. Hoffman. They analyzed the paper published on NPIs in the main journals, Annals of International Medicine, BMG, JAMA, Lancet, New England Journal of Medicine and PLOS Medicine, and the clarity, the details of the NPI are missing. That's why we need to improve, and they contact all the author to obtain more details, especially for who is the provider, what is the procedure, what is the material, what is the intensity, the schedule. And as you can see, the details in the journal is not enough. And maybe you can have also the term physiotherapy program without any or enough details, so no reproducibility for the researcher. That's why we think that we have now a land of confusion between the discipline, physiotherapy, or maybe traditional Chinese medicine, protocol. It could be a program dedicated to fall prevention or maybe to reduce stress. You probably know MBSR, mindfulness-based stress reduction. The components. A component could be a virtual reality headset. It could be a mobile phone, for example. And a confusion with a skill, a unique skill on washing, massage technique, one exercise, etc. And more than that, the confusion could be also with the drug. And we have now a European framework for a drug. We have also a European framework to assess medical device. But we can also have a confusion with lifestyle, Mediterranean diet in general, vegetarian, etc. We can have also a confusion with professional attitude, with public health measure, the tax for tobacco or health campaign. And we can also have confusion with healthcare organization, a specific palliative network. That's why I published 5 years ago a book in Springer to explain that it's now the time to clarify what are NPIs. And one of my PhD students, we published a paper, a review, to determine if we have only one framework or maybe more than that. And we obtained 46 framework in April 2018, 19, sorry, with a lot of confusion. Some person publish recommendations to be clear about the biomedical paradigm, but especially with randomized controlled trial, but double blind. But it's impossible for a physiotherapist if the patient is in front of the physiotherapist. It's a physiotherapy program, so it's not possible. You have also recommendation and framework from engineering, from behavioral intervention, and hybrid paradigm, but we did not have any consensual paradigm framework to assess non-pharmacological intervention. Consequences, to be clear and quick: weak transferability, weak traceability, and weak continuous improvement. And the risk, maybe in your country, is the same. The absence of consensual evaluation framework led the belief that each professional must to reinvent the NPI for each new patient. Or, second aspect, the only real impact on patient's health is a positive patient-provider relationship. In other terms, it's only the relation. What about the content? It's only a question of relation. But if it's only the question of relation, it's probably a placebo effect. So it's not recognized. We don't have a big recognition of this NPI. Worst, we can also have some misinformation, especially in Europe. And we can read some paper that, oh, we have conventional medicine, only biomedical treatments. And for all the prevention and care, we can use traditional medicine without a rigorous assessment, only collect the experience of the patient, and that's it. So it could be, of course, a lot of dangerous consequences. First, for the health of the people, weak efficiency, poor research transferability, lack of professional consideration, weak scalability, lack of continuous improvements, of course, for training, research, monitoring, vigilance. For the society, a weak interest of research investments and also innovation. And of course, confusion provoking an increase of misinformation to health. For the economy, weak traceability, low protection of intellectual property, amalgam with entertainment, a lot of, especially in elderly people, we can have a misunderstanding between health intervention and entertainment. Last but not least, lack of vocation for people who want to care people. And the consequence in the environment, to the environment, importation of products instead proximal services, a kind of dissemination of the care, and a decrease of personal engagement on active health. The patient waits for the miraculous drug, for example. But we have a hope in Europe. Recently, Europe supports a huge grant dedicated to understand the mechanism of NPI. So it's really an important network. And also we have, for example, in France, specific targeted fund dedicated to NPI research. And it could be better to have specific intervention. So our work the beginning was 2021 at the Mystery of Health in Paris. We co-designing a multidisciplinary intersectorial transpartisan specific framework dedicated to NPIs. And of course, I would like to acknowledge and to thank INSERM. It's a great institute in France that supported this collaborative and participative study. The first step was the elaboration of methodological and ethical invariants with 70 participants, 7 meetings, 1 year. We read all the recommendations for all the past framework and share in specific invariant to methodology and also ethics. The second step was specific improvement with open meetings, 300 participants, 4 groups, because we divided patients or users, professional, researcher, and operators. After that, we propose a vote to the final version, 503 participants. And we consulted all the authorities, agencies, and scientific society. So 2 years, more than 1,000 relevant stakeholders, publication, guidelines, white paper book, and we have now the support of specific French, European, and international scientific society from cardiology, from neurology, from supportive care, from respiratory disease, etc. We have also support from public health, and we propose a restitution of this framework to the French Health and Research Organization, Ministry, Senate, High Authority, also Academy of Medicine, etc., etc. We also restituted to Europe, especially European Brain Council, European Commission, ECRIN, and today it's a great pleasure to present our work. We also restituted to Health and Research Organization International, especially for WHO, and especially the Department of IFONES, Department of Non-Communicable Disease, Rehabilitation and Disability, and also to the WHO Academy. And we are beginning the discussion, only one meeting with UNESCO. So to be now concrete, what the results of a study? First, a definition. The NPI or NPI is evidence-based, effective, personalized, non-invasive prevention or care protocol, registered, supervised by a qualified professional. So to be clear, it's a psychosocial program. It's a physical or body intervention, and also it's a nutritional intervention. It's a main domain, of course. And the goal is to prevent, to care, to cure, or to support. And more than that, it's as mentioned in English, manualized, so detailed with a designation, with the main health benefits, secondary benefit, risk, mechanism, target population, protocol, professional, context of use. So it's a theory-based, it's human implemented, it's coordinated with another intervention. It could be drug or medical device or surgery. It's targeted, it's person-centered, it's supervised. So it's a program for precision medicine. The second aspect is the framework after the definition. We call the model NPIS model. We obtain 14 ethical recommendations. It's a little bit classical, but it could be used in France or in Europe or in the world to submit all the protocol before to have a patient agreement, etc. And specific methodological recommendation, especially for because of course, the drug paradigm. Here we mention specific recommendation for observational study, for mechanistic study, for protocol study, for clinical study, and last but not least, for implementation study. Because one intervention could be efficient, for example, in China, but we need implementation study in Europe to demonstrate the opportunity to be implemented in the country. So you will have all the recommendation in this guide. You can also download in the website of the society with all the recommendation and all the aspect. To be concrete, for example, one of the most recognized evidence-based program to reduce the fall, because it's really important for each country in elderly people, is the Ortago exercise program. But in France, in Spain, and so many countries, they don't know this program. And all the professional physiotherapists create their own program. But this program is evidence-based with a reduction of number of fall, of also injuries, and also it's cost effective. You probably know the same difficulty and the big issue with especially Alzheimer's disease. A professor from the University College of London, M.A. Spector, publish and validate the cognitive stimulation therapy, 7 weeks, 14 sessions, persons between 5 and 8 with a psychologist or nurse, and once again, efficacy, explainability, security, and implementability and cost effectiveness. We have also here another example in drug management. It's a specific oral chemo management program because the oral chemotherapy are very expensive and one patient free is not compliant. So this program with one specific session with a pharmacist and free call from the nurse, the result showed increase of compliance, reduction of toxicity and side effects, decrease of risk of death, and improvement of the quality of life of the patient. Here, another example in children with HD, sorry. This therapy from Boston called cognitive behavioral therapy dedicated to these children, 4 months, 12 sessions, 10 individual sessions, and managed by a psychologist, and 2 sessions with parents, decrease of symptom severity, improvement of self-esteem of the adolescent, etc., etc. It's also efficacy. So after all the research, discussion, consensus about the framework, a lot of institutions said it's time now to share to all the person, professional, but also researcher, the best practice of these NPIs. That's why we created an open international registry, launched last year in October. So it's free. It's from now only in French and in English. And you can find the labeled NPIs. So you have cards. So it's clearly details of soft skills of universal best practices. You have also the precaution, the security recommendation, the implementation strategy related to the context, a reference. The card is interoperable, traceable, and fundable. The private or public insurance can pay for this intervention. And last but not least, for the researcher, we want to improve all the NPI cards. That's why after the use for a specific health condition, we can collect informations and also collect feedback from the professional and the patient to propose an upgrade of the cards. To be clear, a card for NPI, we need NPI described, explainable, effective, safe, and implementable. That's why we need one or more prototype study. It could be a pilot study, it could be a feasibility study, mechanistic study, maybe a link to this intervention, 2 clinical trials. We need also to check the safety. It could be the same interventions and trials, and also an implementation study. That's why we have created a specific expertise. The person can submit the details of the intervention, the card, and after the approval, we integrate in the registry and disseminate, and also, of course, collaborate for the improvement of the card. More detail about the NPI, we organize the NPI Summit each year in October. The president of this scientific committee for this year is Professor Iveta Nagiova. Thank you to be here. We also organize regional professional meetings to share the best practice for a specific topic. For example, here in Dijon, dedicated to prevention and care of obesity. We also propose specific digital open badge for the practice and also for the science, to share the scientific fundamental for evaluating NPIs, but also to share the multi-professional fundamental for the practicing NPIs. And the goal is to improve, of course, the efficiency and the safety and contribute to the recognition of practices and professional. Because it's inter-professional work dedicated to health, the experts recommend to create a glossary. So it's a glossary of all the terms dedicated to the practice or the research of NPIs. So it's open. If you want, you can also join us in our monthly newsletter. As you probably know, the World Health Organization published this document for essential medicines, but it's only drugs. Our ambition is to create, maybe in 5 years, 500 cards of essential NPIs, because we think that we have now, especially after the COVID, we need, of course, drug, but we can also combine with specific non-pharmacological intervention. We have now a lot of supporters, especially from France, Ministry, INSERM, Institut National du Cancer, Cancer Institute, Institut Universitaire de France, FCRIN, l'assurance maladie, so public health insurance, and also palliative care. We have also professional organization that support our work, especially, and I would like to thank European Brain Council or Belgian Brain Council. We have also a specific supporter from the patient organization, Parkinson Europe, Alzheimer Europe, and also all the specific organization dedicated to cancer. And we have also financial partner to support all the digital system, assurance maladie, and also autonomy insurance, and some specific Ligue contre le cancer or complementary and private insurance. To conclude, we think that it's time now to be more clear from the research to practice to what are NPIs, and we need NPI card open to promote not only in general NPIs, but this NPI, to gain recognition for this NPI, to roll out this NPI, to ensure the benefit of this NPI, to monitor this NPI, to improve this NPI, to train to this NPI, and last but not least, to increase the value of these NPIs. Thank you very much for your attention. Of course, you can join us. We are thinking about European grants. We don't know if it could be a cost or more than that, but we need to collaborate more in this particular intervention, very useful for the population. Thank you very much. And we are ready with Iveta for your questions.
Thank you very much for a very interesting webinar on this emerging subject. It's now open for question. You can send your question on the Q&A. Or if you want to open your microphone and just raise your hand with the tools and ask your question. Anyone? Please, Naomi, I'll just let you open your microphone. You can unmute yourself now.
Hello, and thank you very much for this overarching presentation that opens our mind, and we feel that we are right there, but we struggle and we need to unite somehow to make it happen. So thank you. Unfortunately, the chat is closed. Just for your awareness, I couldn't write my question.
You can write it in the Q&A, but the chat is now open.
Thank you. So I conduct few research and action projects right now. If in the audience anybody is interested, we launched a project for women, public health for women in menopause that struggle with sleeping problems and some malfunction, cognitive changes. And if anybody is interested, please, I invite participants or collaborations. So thank you again.
Thank you for your remark.
I do have a question. With your experience, what are the key factors that influence whether citizens perceive institutional intervention, such as lifestyle programs or behavior changes, especially after the COVID, as supportive tools for their well-being rather than restrictions on personal freedom, which is a huge topic for discussion.
Maybe, Iveta, do you want to mention something about the behavioral intervention and maybe also the difference between lifestyle in some way and also advertisements? It's not really clear because it's intangible intervention. Maybe, Iveta?
Yeah, sorry, I was thinking actually about something else while you asked the question, and I was a little bit referring to Naomi's comment, which is very important and very relevant, that you said that we are doing a lot of things, but we are not there yet. And I think this is very, very important. And actually, maybe it will also answer a little bit your question, which you are asking about interlinks between public health and non-pharmacological interventions or behavioral interventions or salutogenic interventions, as Gregory said. So there has to be a clear distinction because we are using this term very, like confusingly, but at the same time, NPI are presenting a wonderful opportunity. And I was just thinking within the context of 4 high-level meeting of United Nations Assembly on NCDs, which is going to happen in New York on 25th of September. As you know, we are not doing very well with regard to the prevention and control of non-communicable diseases. And I believe, and therefore I'm very grateful to Greg for this wonderful opportunity for collaboration, that NPI are an important answer to the question. Because we have overburdened, overstretched healthcare systems, social care systems, we need to find new ways how to be more effective, how to be more innovative, and NPI present this opportunity. We live in the era of misinformation, disinformation, proliferation of different kind of practices which are not evidence-based. And actually, this is our main action here, our main purpose here, to create the registry of evidence-based non-pharmacological interventions, which can be widely used, which by experts all over the world. And sorry, I'm just trying to put together a lot of ideas, a lot of things, but I'm just reflecting on what Greg said and what Naomi said and what you said. So in the understanding how we understand it, the non-pharmacological intervention as the society is what explicitly Gregory said, that it's a psychosocial intervention, it's a nutritional intervention, it's a physical intervention, but it's not necessarily the public health intervention. So it's not the taxation. It's a little bit broader. So okay, so I think I will stop here, and maybe it will create the space for some additional reflections or ideas or comments. And I just would like to encourage everybody really from the audience to come in and to react on what we just said.
Hi, may I ask a question, please?
Yes, please, Naomi.
Thank you. I'll introduce myself. My name is also Naomi, but this is just a coincidence. It's a very rare name, actually. My name is Naomi Fliss. I'm head of the research department at the nutrition division of the Israeli Ministry of Health. So I'm a dietitian and an epidemiologist. And my question is, I'm looking at the RNI registry right now. After your very interesting talk, Gregory, thank you so much for all the information you've provided. It was extremely eye-opening. And I see that we have no nutritional interventions at all at the registry, though I have to say that from my personal experience and also from my professional knowledge of nutrition worldwide, it seems to me that there are quite a lot of nutritional protocols that have already been validated and recommended by medical authorities. I was just wondering, why is that the case? And if there is anything you can maybe there's like a logical explanation to this, or maybe it's just a matter of adding data to the registry in order for these to be assigned. And if so, maybe you could just briefly go over the methods by which the registry is widened by information, so that maybe we could help with the nutritional protocols that we would like to see in the registry.
Iveta, do you want? Before?
No, I think it is your field, Greg. Thank you.
Thank you, Naomi, for this question. You know that the beginning of the story was before a philosophical point from 10 years. And after, it was the time to determine the framework. And last year, it was the beginning of the launch of the registry. And we have only, I agree, only 11 interventions, but we want to collaborate now. It's just the beginning. And please submit, especially intervention and the difference between the public health recommendation. Please eat less meat, red meat, etc. It's a public health recommendation and targeted intervention. And
Exactly.
we all the researchers from the dietetics, from nutrition, from psycho intervention, for physiotherapy, etc. Please, it's time, and it's just the beginning. And we have an internal discussion, very difficult, with the team. If we launch with only 11 cards, because it's not enough. It's just cancer patient and elderly people. We want to increase the number, but it's with you. It's with all the European researchers. And also we think that it could be because you will have a kind of publication because you submit your card, and the name will be your name or a team or institution. And we think that you can also, after, collect all the feedback from the, but you have a real time for the submission and to be her author. It could be more important than the publication now because of artificial intelligence. You have so many journals, but it could be very, very important for the scientists to have a real to have a concretization, a materialization of his or her own work.
Yeah, so just to add, and perhaps to simplify the very complex Gregory's answers for Naomi, you can submit any protocol that you have and that you are working at. We would be very grateful. And actually, this is actually the encouragement for everybody else as well. It will be checked because it has to be evidence-based. So we are going to check what is the evidence behind it. So it's question number 1, but basically you can use it. So please submit to the registry any protocol. And the second thing, which is related to questions, which I can see whether food supplements are also within the umbrella of NPI, it is a very, very important question within the context of how confusing the definitions are. And maybe, I'm not sure, Gregory, whether you mentioned it, but we understand NPI as something what has its start, has its end, and is carried out by a trained professional. So maybe this can answer the question.
And to be very concrete, in your chat, you have the system to submit your proposal.
Okay, that's great.
Everything is free, of course. We are an NGO, and everything is free for that.
Great. Okay, so the information about how to submit a card, for example, is I can find it in the website.
Yes, you here with the link, you have a FAQ and all the detail to submit. And maybe I can also, we will organize next, not this Friday, but next I will send you maybe the specific webinar to how to write an NPI card. It could be useful for you, and I will send you right now.
Yeah,
that would be great.
Session. Perhaps, Greg, if you can, maybe you could put it into the chat. So it's a specific training session.
Yeah, I don't. I try. I'm going. Please, just few seconds.
Thank you so much, Gregory. That would be very, very helpful, and I'm sure that
You're welcome.
I'm sure that we could get a lot of cooperation from. I can speak for Israeli dietitians.
So this is here the masterclass last with the teams, and you will have 45 minutes with all the details in English, and we will share also a Word file dedicated, an example to help you to write and submit a file.
That would be great. Thank you so much.
Thank you very much, Naomi.
Thank you.
It's great. There's another question that was sent to you in person. Maybe I will read it. Taking into consideration the placebo effect and the nocebo effect and the role of personal auto-suggestion, how much of the effectiveness of non-pharmacological intervention do you think can be explained by this mechanism, and how much goes beyond them? And in your view, what makes NPI truly effective and sustainable in real-world healthcare practices?
It's a classical question. Each treatment use placebo effect, but we recommend all the methodological, technical, design outcome measure to reduce at the maximum the bias. But of course, we will have a specific, a small placebo effect. But with all the experts, more than 1,000, we obtain the best recommendation for the best evidence for the practice of NPI. It's not possible. And if you want to blind to the physiotherapist that the patient go to the physiotherapist, it's not possible. So you have a specific framework for the drug validation. You have a specific framework for the medical device in Europe now. And we think that we need now, it's time now to have a consensual framework to assess non-pharmacological intervention. And maybe one more sentence, and it's not dedicated to assess a health organization. It's not dedicated to assess the tobacco taxes. No, no, no. It's just a specific targeted intervention, immaterial intervention, but we have a consensual evaluation. And it's unbelievable that this protocol could be used in Slovakia, in England, everywhere in the world. And we have to share the best practice about this practice and not all the time to reinvent the wheel.
Yeah. And actually, it's with non-pharmacological interventions, NPI, it is basically the same principle as with the drugs or with pharmacological intervention, because you have to have the randomized control trials. In drugs, it can be double-blind. Gregory said that NPI have its limitations, but you can do quite a lot. And when you, for example, look into the cognitive behavior therapy, there is a huge abundance of research which shows that it is effective and how it is effective. And so this is one thing which I would like to highlight. So we already have a lot of evidence. The second thing which I would like to highlight is that also the methodology in NPI is developing. So therefore, we mentioned in the beginning the International Behavioral Trial Network, which is explicitly working on improving of the methodology of behavioral or non-pharmacological interventions. So this is not something static. It is a field that is moving forward, and we are embracing new ideas, advancements in research, even technologies, because we did not mention, but digital technologies and health applications are also part of the NPI. It's a tool which could be used.
Absolutely.
And I also think it's very important in chronic disease and in prevention. There is a say that the Chinese doctor for the Chinese Caesar, the king, said that he was paid to keep the king be healthy, not when he's sick. So it's the same thing. Prevention is much better than taking care of the disease.
Absolutely.
Afterwards.
This should be the change in the mind shift everywhere within the world. But it is not so easy, right? It is not so easy because then you can have also some people who would false to make people healthy instead of treating them. So it's a bit a tricky question, but in general, it's a very good strategy to monetize medical doctors and health systems to keep people healthy and not to treat them when they are getting sick, actually, and to keep them sick, so to speak.
You're perfectly right, because it's also behavior, and behavior could be a risk. And to change behavior before the disease, it's important. And the precision medicine is about also behavior. But you can see in elderly people, the concept of frailty. You don't have any disease, but you have a frailty. And the frailty could be maybe reinforced by non-pharmacological intervention. We have to change our mind also, because last century we think about one problem, one drug. Now we have maybe complex problems, and we need multiple solutions. And with the precision medicine, especially, for example, in my topic, in cancer, the cancer is now detected very early. And because it's very early, we can use some prevention or supportive care to improve the quality of life, the health of the patient, and maybe to reduce the risk of another cancer.
Indeed, and maybe some is considered to be esoteric approaches like the recall healing, like the New Germany medicine, like systemic constellation, and others might be part of this program to prevent cancer ahead of time.
Right. That's why we need rigorous research in this topic to determine if maybe it could be possible, a psychotherapy. Please check rigorously the psychotherapy to prove that you can improve maybe the sleep trouble. But please demonstrate, prove, and that's why it's a differentiation from alternative medicine or maybe non-evidence or non-scientific intervention. Sure.
Indeed. So in sake of time, we need to finish here. Thank you very much, Gregory and Iveta, for this interesting topic. And once again, the link will be sent to all registrants and with the information. It also will be on the ERA4Health website. Thank you again.
Thank you very much.
Thank you. It was a great pleasure. Thanks a lot.
Thanks.
For the